Hi everybody, my name is Lisa Smith and I am the project lead for the establishment of one of the COVID vaccination hubs here. This is Western Health's COVID Vaccination Hub, and this is our airport hub. And as you will know, we've got a hub at Sunshine Hospital, and this is Kylie.
So I'm going to be the unit manager here, and we just wanted to show you around today so that you can have an understanding of what this place is going to be looking like.
So this is the entrance. We're based in Terminal 2 of the International Departure Lounge, down the end of the runway, and this is where the staff will enter, border facing staff at this point in time, and they'll come into this entrance point here through to the vaccination hub, and then we walk on through.
And first off, they'll be greeted by the security team to make sure that their temperatures are okay, and our nurses will be out here as well to make sure that we can take them through a normal pathway. So this is the entrance they will come through, and then they come into our admin area.
So this is the check-in area. This is where we'll have our administrative staff to check them in, check details, check things like information with regards to Medicare numbers and any identifiers that they require. And then from this point forward, then they'll move down to, in the short term, whilst we're on a paper-based system, we've had to establish some waiting areas so that the vaccine recipients can fill out some forms. But in the fullness of time, when we have the COVID vaccine management system, that'll all be via a mobile phone. So the recipients will come down this way. We've got hand washing facilities here at the entrance.
Staff first thing of the morning will be able to come straight through the doorways here and not have to come through the cubicles. But the patients will continue to come along this way. And at this spot here, they'll be greeted by one of our marshals who will work out which is the best space for them to go to. If they're completely 100% normal, they'll come through to these first ends. But if there's some difficulties, or if they're a bit nervous about injections, things like that, we would take them to the far cubicles, which we can then lay them down if we need to.
Cubicles 1 to 10. So we'll take you through probably down this way. All the cubicles are set up the same. So there will be a nurse immuniser in these cubicles, potentially a Ruson in the as we progress with recruitment to Rusons. Check-in will occur here. The vaccine recipient will be sitting here in the chair. We will confirm the pre-immunisation screening, confirm that consent has been provided by the vaccine recipient. The vaccine recipient will stay in this position here. Moving into a nurse immuniser will be in this position. The vaccine will be provided by pharmacy, the pharmacy hub, over there at intervals. And what will happen is that 6 doses of the vaccine will come over in syringes. At this point, the syringes will have the needle applied according to the size of the patient, and the vaccine will be given to the patient. A vaccination card record will be given to the patient, to the vaccine recipient, with the details of their doses on there. When we confirm that they are okay here, there's obviously privacy, so they're able to disrobe to ensure that we can get a good view of their arm before administration of the vaccine. Once they've had the vaccine, they'll move out into the observation area, of which you can see socially distanced chairs. We wouldn't expect that this will be a full area, and what there will be is a Ruson or a registered nurse and a team lead in this area who could have visibility of all of the vaccine recipients who have just received their vaccine and are waiting for their 15 or 30 minutes, depending on their risk factors of how long they need to actually wait in this area. They'll be provided with information what to expect after you've had a vaccine, and once their time has elapsed, with some clocks around so they can see what time that they actually need to leave, they'll exit over this door over here. So an opportunity to wash their hands if required on the way out, At this point in time, we are dealing with some paper, so they will drop off their forms here. At that stage, any forms and any clipboards that have been used will be sanitised, and then the vaccine recipients will exit out one way out and then back around to the entrance. Other things we have in this space, communications area, so that is all of our ICT and routers that are all linked to Western Health Network, so everything here is on the Western Health Network. And we have a pharmacy area here. This is obviously where the preparation of the vaccine is going to occur. Swipe card access to get in here, so only those authorised will be able to access this space. So the vaccine preparation area for the pharmacists and those who will be assisting with the reconstitution and preparation of the vaccine. The fridge spaces that we have in the corner, these are just the fridges, so the vaccine would have come from Junkana Pharmacy from the freezer in refrigerated transport, and then they'll be obviously kept in the refrigerator here. In terms of a backup, we do have a backup fridge should there be a cold chain breach, so that we can actually move the vaccines to this fridge. Preparation zone, hand washing facilities for the staff, and workstations set up to enable the reconstitution and preparation of 6 doses per vial that comes to us. Kylie?
Our very special clean stores, so we've got everything that we require here, and we'll be decanting that into our pharmacy, and we'll also be grabbing more stuff from Sunshine as well on a regular basis. The command centre, so this is where our unit manager will be sitting, our assistant unit managers as well as our medical staff as well. So we've got the 3 PCs in here ready to go. And we can see out, which is lovely to make sure that everything's going nice and smoothly.
Male and female changing facilities in there for people to change into when they first come on at the commencement of the shift. And further down the back, all the cubicles are set up exactly the same. Thoroughfare.
We've got our resource bay here as well, so if anyone is feeling unwell, anybody has vasovagal or they have an allergic reaction, we can actually bring them into here.
In terms of resuscitation equipment, AED, anaphylaxis kits, and ability to obviously do monitor their vital signs as well. So the escalation procedure is to contact Ambulance Victoria here and 000 call, and they will be the first responder. Bearing in mind that we do have a medical officer on site all the time.
Our donning area, so that first thing in the morning everybody can get themselves organised. Plenty of gear here for everybody to get themselves sorted first thing in the morning. Because we are looking after possibly red zone people, we will be in tier 2 PPE gear.
Storage area for more of our PPE. One of our cubicles is dedicated for the pink stream vaccine recipients, who are those that we have indicated are high risk. There's the ability, if they're feeling a little bit nervous about having the vaccine, that they can actually have it in a lying down position, but also certainly for those who are high risk, we would start them in this cubicle. Entrance into the staff amenities, obviously hygiene station, recording of your break as well for the break log for COVID.
And then welcome to our staff room.
With a very nice view of aeroplanes that you don't get to go on in the short term, but a nice view for your break when you're in here. So all the facilities are in here. Areas to leave your bags, tea and coffee,
Refrigerators for your meals as well.
Yep.
The reason why we've got everything sorted in here is because once you're actually in this zone, you need to stay here until the end of the shift. So we're encouraging everybody to bring a packed lunch because you won't be able to actually go out for lunches and stuff.
Yep. And the staff amenities, toilet facilities are at the entrance to the hub.
Your attention, please.